Welcome to TcB Neo Care. In today's video, we'll learn about one of the most important topics in neonatal jaundice management. Understanding bilirubin levels and the difference between TSB and TcB, two methods used to measure bilirubin in newborns. Before we begin, don't forget to subscribe to TcB Medical Technologies. Your support helps us create more valuable and educational content for healthcare professionals. Bilirubin is a yellow pigment produced when red blood cells break down. Newborns, especially preterm babies, have immature livers, so bilirubin builds up faster than it can be removed. Knowing the bilirubin level accurately is essential to decide when to start phototherapy, when to stop therapy, when to escalate to intensive phototherapy, when to consider exchange transfusion. This decision to do phototherapy depends heavily on TSB and TcB measurements. TSB stands for total serum bilirubin. It is measured by taking a small blood sample, usually from the baby's heel or vein, and sending it to the laboratory for testing. The test shows the exact bilirubin concentration in the blood, both the indirect and direct forms. That's why TSB is also called the gold standard for diagnosing jaundice. Doctors mainly rely on TSB results when the baby has very high bilirubin levels. Jaundice appears within the first 24 hours. The baby is preterm or sick, or when they need to decide whether phototherapy or exchange transfusion is required. In short, TSB gives the most accurate measurement, but it involves a blood sample. Now, let's talk about TcB. It means transcutaneous bilirubin. This test is non-invasive, meaning no needle or blood draw is required. A TcB meter, a handheld device, is placed gently on the baby's forehead or chest. It shines a small beam of light through the skin and measures how much yellow pigment, bilirubin, is in the tissues. The device then gives a quick reading of the bilirubin level. TcB is painless, fast, and safe, which makes it ideal for routine screening before hospital discharge, regular bilirubin monitoring in stable newborns, reducing unnecessary blood tests. However, TcB is just an estimate. It may not be as accurate when the baby is under phototherapy, the skin tone is very dark or very light, or bilirubin levels are extremely high. So, when a TcB reading looks high, doctors always confirm it with a TSB blood test. So in short, we can say that TcB is used for screening, a quick, painless check. TSB is used for diagnosis and treatment decisions, especially when jaundice is severe or rising fast. You can remember it as TcB to check, TSB to decide. Measuring bilirubin accurately is very important because, if bilirubin becomes too high and isn't treated on time, it can cross into the brain and cause serious conditions like acute bilirubin encephalopathy, kernicterus, which can lead to lifelong issues such as hearing loss, vision problems, or developmental delays. Accurate and timely bilirubin measurement, using TSB or TcB, ensures the baby gets phototherapy or treatment at the right time and prevents these complications. So, to sum up, both TSB and TcB are essential tools in newborn care. TcB helps with early screening, and TSB confirms when treatment is needed. Together, they help doctors provide the safest and most effective care for every baby with jaundice. If you found this video helpful, don't forget to like, share, and subscribe to TcB Medical Technologies for more educational neonatal and phototherapy content. For more information, visit www.tcbmedical.com or contact us today.